I'm Joe Camp, and I've been a practicing endodontist for over 40 years. I've also been teaching part-time throughout my career. In the past, treatment of teeth with open apices and necrotic pulps was very difficult. This has been simplified with apical plug procedures utilizing ProRoot MTA. When I began my career, these teeth were considered hopeless for permanent retention. Development of apexification treatments in the 1960s allowed us to save these teeth, but the prognosis was still questionable. The introduction of ProRoot MTA as an apical plug has completely changed the treatment and prognosis of these cases. Here are some examples. Here we have, in this first case, two maxillary central incisors with necrotic pulps, open apices, and big, large lesions surrounding the apices. Once these teeth are cleansed in a routine endodontic manner, the apices are then filled with a plug of 4 to 5 millimeters of depth of ProRoot MTA, and then the remainder of the canal is bonded with a bonded composite. And here is a completed procedure on these two cases. This case is of a maxillary central incisor with a necrotic pulp and a large apical lesion. The patient also is undergoing orthodontic treatment. In order to establish length in a tooth with an open apex, you must utilize a radiographic method by inserting a file and taking a radiograph, because the apex locator will not work in a tooth with an open apex. After the tooth is cleaned thoroughly in a routine endodontic manner, the apical plug of MTA is placed and the remainder of the canal is filled with a bonded composite in order to strengthen the root. And then here is that case 2.5 years later, showing resolution of the apical lesion and retention of the tooth. Utilizing ProRoot MTA as an apical plug has shortened the treatment time from what was years to weeks. Every general dentist should have this technique in their bag for treating immature teeth with necrotic pulps. I'm Joe Camp for Chair Time.